All right. So we are discussing about the tetracycline. Okay. So in tetracycline, what is the basic thing that we should know? See, tetracycline is also a very old drug, and tetracycline is such a drug which we have actually used a lot, even during COVID times. Also, tetracycline has worked a lot. We have given a lot of medications of tetracycline to patients. So, how does tetracycline work? So, in a long time back, when we started discussing antibiotics, so we started discussing those antibiotics which are having a real problem with the your this thing like cell wall formation. Penicillin, cephalosporin, they had a cell wall issue. Next category we discussed that was having the issue with the 50s and 30s ribosome issue. Now today the drug that we will be discussing, this will also work at the ribosome and it will also work at the 30s issue. Okay, so who else was interfering at the 30s site?
सर ये क्या बोले aminoगlycosides.
Yes. So over there it was aminoglycoside which was actually binding to 30s ribosomal unit. Now here what happens is, first of all, this tetracycline, it can enter any bacterial cell through active or through passive transport. It can be both. Now over there it will bind with 30s ribosomal unit. Now when it binds with like 30s ribosomal unit, here one point I would like to mention, that is okay, just tell me one thing, can you see the screen cursor?
ना सर कर्सर दिखते पाচ্ছি না.
No, sir.
uh, अच्छा, okay. Just a sec. Is it possible? No. Acha, okay, now
हाँ सर.
cursor is seen.
हाँ.
Okay. See over here, like I have mentioned, that there is a thing called as hydrogen bond. So this you have to remember, that there is a hydrogen bond which will work over here. Okay, see, can you see this thing now? Hydrogen bond. So it binds over there with hydrogen bond. Can you see the laser pointer?
हाँ सर दिखते पाচ্ছি.
স্যার আরেকবার রিপিট করুন, আমার একটা কল ঢুকে গেল দিয়ে হবে না।
I'm just saying that when it binds, this tetracycline binds. So tetracycline will bind to 30s ribosome, that is the ribosomal RNA, but the type of bond is very important here. So which type of bond it is using? It is using hydrogen bond. That is what I am trying to talk about.
Okay.
All right. So over here, and then it is going to have other interactions with the ribosomal RNA. Now what will happen? Look at the diagram. Can you see the diagram on the upper left corner?
Yes, sir.
हाँ सर.
Right. Over there you see, where is tetracycline binding? Where is tetracycline binding?
सर TRNA एड जाएगा है.
हाँ. So, and where was aminoglycoside was binding exactly?
aminoगlycoside तो proof reading করতে বা ইয়ে করতে দিত না. বাইন্ডিংটা দাঁড়ান actually.
Yes. So basically what you have to understand is, these, like if I talk about aminoglycosides, see, both are 30s, na? So here you can develop a confusion. So there is nothing to get confused. Aminoglycoside, they cause misreading. Okay, there's proofreading was a issue, so it causes misreading of the genetic code translation. So over there what happens? Faulty protein, non-functional protein, they will develop. The bacteria will start developing faulty protein, non-functional protein.
हाँ सर.
But tetracycline inhibit the synthesis, because it is binding to that codon. So if it binds to the codon, do you think those tRNA, which carry the, do you know tRNA carry amino acid? Like one example there, that methionine wala amino acid is being carried by the first tRNA.
Yes, sir.
So when a tRNA is carrying amino acid, it is called as amino acyl tRNA. So it is, so basically it prevents this amino acyl tRNA attachment, okay, to the ribosome. So that's the point. Okay, it prevents amino acyl tRNA attachment to ribosome. Understood? So this is the basic difference.
Yes, please.
So where will,
আমি বলছি টেট্রাসাইক্লিন তো বেশি রিলায়েবল হওয়া উচিত।
definitely we'll see to that, but you cannot use it in every case, so that is why the entire lecture, entire discussion.
Okay, sir.
So if we talk about these tetracycline, so tetracycline is going to bind to the A site, ribosome's A site, you know, that was A site, P site and E site was there, na? So it is going to bind to the A site, so and it is going to interfere with the like amino acyl tRNA thing. Now if tetracycline is binding over there, then protein elongation will not take place. So because if there is no amino acid, tRNA is not binding, then why will amino acid get transferred? If amino acid does not get transferred, there will be no chain elongation. Slowly chain elongates, na? When one amino acyl tRNA comes up, then there is a amino transpeptidase enzyme is present, so it helps two amino acids to join. This is the regular process of translation. Do you remember that?
Yes, sir, জানি, মনে আছে।
So if here the what do you say, this amino acids, they do not come up and they do not join over here, then how will there be chain elongation? So chain elongation is out of question, and if there is no chain elongation, you understand that like the bacteria will definitely die, it won't be able to survive. Okay, now
Yes, sir.
talking about the spectrum. Now see, this is the answer to your previous question, that this is a better antibiotic, because last time aminoglycoside, it was preventing the, like it was causing misreading, so it was creating protein, but it was creating faulty protein. But this time we are seeing that no, it is not creating as such any faulty protein, but it is actually creating no protein at all. So that means it is supposed to be better. But let's see against whom it can work. So number one, it can work against gram positive bacteria, it can work against gram negative bacteria. Do you remember aminoglycosides used to work against whom?
Sir, aerobic gram negative.
Aerobic gram negative, yes, but this time it's of course better, because it is working against gram positive as well as gram negative. That means this tetracycline can work against Staph aureus. You remember Staph aureus was a big problem with penicillin. So if you find that there is an infection with Staph aureus, you can always go for this tetracycline. You have a better thing. Say Streptococcus pneumoniae. Okay, it causes Streptococcus pneumoniae, causes pneumonia. Then Clostridium. So Clostridium botulinum is there, Clostridium perfringens is there, okay, Clostridium tetani is there. So it works against all these Clostridium species. Then Bacillus anthracis. You know there is a disease called as anthrax. So
Yes, sir.
yes, then Listeria, okay, monocytogenes. So these are all gram positive bacteria. So whenever there is gram positive bacteria, you can easily use tetracycline. Then comes up our regular E. coli. E. coli is it's a symbiotic bacteria present inside our gut. So if you ever see that there is a high growth of E. coli and the symbiotic nature is getting lost, then you can use this tetracycline to kill the E. coli. Even if there is typhoid, because Salmonella species, Salmonella typhi type A, Salmonella typhi type B, and Salmonella typhimurium. These are the 3 types of species which can cause enteric fever. Enteric fever in our state, it is called anthric. Okay, that enteric becomes anthric. So actually it is enteric fever. Enteric fever is typhoid. So that's caused by the Salmonella species. So you can treat typhoid with this also. Then we have got Shigella. So there is a disease called Shigellosis. Okay. Then Haemophilus influenzae. Do you know Haemophilus influenzae causes pneumonia? Are you
Yes, sir.
observing one thing? Ki for pneumonia, you have some Diplococcus, you have the Streptococcus pneumonia, you have the Haemophilus influenzae. So out of these, Haemophilus influenzae and Streptococcus pneumoniae, both can be killed by this tetracycline. That means one thing is there, that see, with tetracycline we can try to cure pneumonia very effectively, isn't it?
হ্যাঁ স্যার
Yes.
নিউমোনিয়া খুব ভালোভাবে টেট্রাসাইক্লিন
হ্যাঁ। Then comes up Neisseria gonorrhea. This previously also we have discussed, even some penicillin species was actually killing Neisseria gonorrhea and it was preventing it from gonorrhea. Then we have got Vibrio cholerae. So Vibrio cholerae will cause cholera. Okay, so cholera can be treated, then gonorrhea can be treated by using tetracycline. So tetracycline has got so many use. Then there is a disease called as chlamydiasis. Chlamydiasis is caused by Chlamydia trachomatis. So this is also STD, just like Neisseria gonorrhoeae. Chlamydiasis is also this thing. It's a STD, sexually transmitted disease. And you see Mycoplasma pneumonia. See, we were talking about pneumonia. So you see, atypical pneumonia is caused by Mycoplasma. So you see, if you are giving tetracycline and suppose the patient is suffering from some atypical pneumonia, still the person might get cured. So it's such a beautiful drug for treating pneumonia. Then there is a disease that is called as Rocky Mountain spotted fever, which is called as the rickettsia, which is caused by the rickettsia. So gram positive, gram negative, atypical pathogen. And then we have got spirochetes. I think spirochetes, so you understand, what are spirochetes? They are basically spiral bacteria. Okay, they are spiral bacteria like leptospira, which causes leptospirosis. Then you have got treponema. Treponema pallidum causes syphilis. Syphilis is also a STD. Okay, then there is something like there are some pathogens which are present inside the cell, intracellular pathogen. So what are intracellular pathogen? See, chlamydia is a very prominent intracellular pathogen. When a patient is having chlamydiasis, it is, in common language, it is said that it is a disease which cloaks itself. Why will the disease cloak itself? Or what do you mean by the word that the disease which cloaks itself? Cloak is like a garment. Do you know the garment cloak? Like a big, long, coat kind of a thing. Cloak.
ওই ইনভিজিবিলিটি টাইপ অফ থিং
হ্যাঁ, তো in Bengal it is called al-khalla. So that is the cloak. Like if you have observed this that creation of J.K. Rowling, Harry Potter, over there he used that invisible cloak. So that's a cloak. So cloak means underneath which you can hide. So this chlamydia species, mycoplasma species, what do? They actually enter inside the cell and they remain hidden over there. So tetracycline can kill that as well. So tetracycline is very, very good as such. Even tetracycline can be used against some resistant bacteria. Okay, because of this. So it's a very good drug. But there is a problem. The problem is that it is less active against anaerobic bacteria. So you see, last time that we observed, aminoglycosides were working against aerobic or anaerobic?
স্যার অ্যারোবিক্স
Which one?
এরোবিক স্যার এরোবিক
Aerobic. It was working against aerobic. So you see, tetracycline is also working against aerobic. It is less active against anaerobic bacteria. So this is a big, big problem. Understood?
হ্যাঁ স্যার।
Now, let us talk about the kinetics, okay, the pharmacokinetics. So, do you recognize this medicine that is given on the left hand side?
না স্যার।
This is the medication which I have prescribed lot of doctors have prescribed actually during COVID time for regular like COVID cases. Even for we use it in general. We used to use it. We will use it in general, even for dental cases also. I'll come to that gradually. Just
তার
remember.
নামটা শুনেছি।
So it is doxycycline. So I'm not asking you to focus on that lactic acid wala portion, but you can just focus on the doxycycline wala part. So yes, doxycycline. So that is the thing. So let's talk about the kinetics first. So as far as the absorption is concerned, you will see that these are all oral drugs. Like as the photo goes on the left hand side, this is definitely a oral drug. Now, if you are giving orally, so the next question is it capable of working or not? Is it capable of getting absorbed or not? So yes, absorption is good. So of course absorption is good, that is why we are giving oral drugs, isn't it? Now there are certain things that you need to keep it in mind. That is calcium, magnesium, iron. Where are these present? Mainly, say calcium tablets are there, but what about magnesium? Multivitamin tablets are there, iron capsules are there, and
হ্যাঁ স্যার।
if you see the bottles of, or why bottle only, even tablets also, if you see those of antacids, what is written over there? Aluminium or magnesium trisilicate. So
হ্যাঁ স্যার।
all of these things, they all have divalent cations. Okay, so that is the reason, if these are present, they will not allow absorption of doxycycline or tetracycline, because tetracycline will bind with these elements. So it's also acting like a chelating compound, so they will chelate with tetracycline, and if they bind with tetracycline, then tetracycline is no more free. If tetracycline is no more free, then definitely it is not going to get absorbed. Understood?
হ্যাঁ স্যার।
Okay. So once we have discussed, so you see that is what is written over here in the entire absorption. Clear? Absorption? Alright.
হ্যাঁ
Acha. So next thing that we talk about is the distribution. So large volume of distribution is there, so it will spread in like various places, so not a big deal. Now over here we can also see that it can also cross cell membrane, it can cross blood-brain barrier, placenta, and definitely it can be expressed in the breast milk. Okay, so since it has got a large volume of distribution, so it can go into any body compartment. Next thing is, as far as metabolism is concerned, it doesn't get metabolized, so it is excreted in its active form. Okay.
ওকে।
হ্যাঁ স্যার।
Okay, now comes up the elimination process. So for elimination, it is kidney. Okay, so if it is kidney, then definitely you understand that it must be polar. It is not non-polar. If it would have been non-polar, then it would not have dissolved in the kidney. So it is excreted through kidney. Now, what is the T half of tetracycline? So T half of tetracycline is 6 to 12 hours. So definitely half-life is short. So how many doses you want to give to the patient daily?
তাহলে তো মানে 6 6 to 12 হলে দুটো দেওয়া উচিত মানে
Exactly. So usual the dose that we give is twice daily, because within 12 hours its amount will become half, and if I have to maintain a very high concentration, then by that time already another drug should have kicked in. So that is why we give mainly two drugs, like 2 doses daily. Okay, now moving as far as the dosage form and administration is concerned, so like we discussed, the photo that you observed, that was capsule. It can be available as tablets. For kids there are some oral suspensions also. Okay, so like see, that is what is written over here. The choice of dosage form depends on specific indication and patient's age. So like if they are very young, pediatric cases.
হ্যাঁ স্যার
So if there are pediatric cases, so they won't be able to swallow such big capsules or tablets. So in those cases, we give them some oral suspension. Okay, and naturally, all these drugs are given orally. Now, best is this drug should be taken on an empty stomach. Why? Because this drug has got a very high interaction with food and divalent cation. So if you do not want all those things to happen, so ask the patient to take it 1 to 2 hours before meal or 1 to 2 hours after meal. Okay, so that tetracycline gets absorbed. Like when you write prescription, you have to write all these things, that you should take the medicine before meal or after meal. So here it is up to you. Either you ask the patient to have it like before meal, 1 to 2 hours before meal, or you can write like have it 1 to 2 hours after meal. Clear? So you have to keep it in mind. I'll tell you in dental cases where do we use it, but one thing is sure, that we use it. You can trust on me.
আচ্ছা
And
বলছি ডাইভ্যালেন্ট ক্যাটায়নটা কিভাবে ইন্টারঅ্যাক্ট করে
কি করে?
মানে ডাইভ্যালেন্ট ক্যাটায়নটা কিভাবে মানে ফুডের সাথে কিভাবে ইন্টারঅ্যাক্ট করে অ্যাসিডের সাথে করে কি স্যার
না ডাইভ্যালেন্ট ক্যাটায়ন টাই রয়েছে ফুডে. ফুড কন্টেন্স এ ক্যালসিয়াম, ডাইভ্যালেন্ট ক্যাটায়ন.
ও হ্যাঁ
ফুড কন্টেন্স এ ম্যাগনেসিয়াম, अगेन डाइवैलेंट कैटायन है ना.
হ্যাঁ স্যার বুঝেছি
So we do not want that. That is why if you are drinking milk, it will have calcium. If you are eating any food, say meat and all, so it will have calcium in it. So that calcium will interfere.
বুঝেছি
Okay. Now talking about this clinical use. So first clinical use is, of course, it's antibiotic. So let it fight the bacterial infection. So first thing is, see, we are talking about the respiratory infections. Now you understand why in COVID cases we are giving a lot of doxycycline. This is the thing that I was trying to tell you. The doxycycline was killing Haemophilus influenzae, it was killing Streptococcus pneumoniae. So you see, once again we start our discussion with respiratory infection. So respiratory infections, see again, Mycoplasma pneumoniae, Haemophilus influenzae, those same names are coming back again and again. Now not only respiratory, even remember urinary tract infection can be treated with this doxycycline. Okay, then comes up like we discussed was shigellosis. Okay, shigellosis, what kind of disease? Do you have any idea what is shigellosis? Anyone? Okay, and
এটা পড়েছিলাম স্যার এটা মাইক্রোবায়োলজি শিগেলা পড়েছিলাম
হ্যাঁ, তো but shigella to is the organism. What happens in
মানে
shigellosis?
ব্যাকটেরিয়াটা শিগেলোসিসটা করছে
Bacteria shigella. Okay, so do you know what is actually shigellosis?
স্যার ওই ইকোলাই টাইপ অফ ইনফেকশন কি করে নাকি পেটে
Yes, first of all, yes, this is true, that it is an infection of your gut, stomach. So, acha, chalo, for the time being it will be fine. Then there is another organism called as Campylobacter jejuni. So from the name only you can understand that they will be having some connection with jejunum. So Shigella and Campylobacter, both of them, they are working on your gut. And tetracycline can prevent you from suffering from the GI infection. Then there can be skin and soft tissue infections. Okay, like cellulitis I discussed, I think, the last class. Talking about that Ludwig's angina. Then there can be abscess, then there can be infected wounds. Okay, these things can happen. Then talking about sexually transmitted infections. So if you talk about the sexually transmitted infections, so we discussed about chlamydia and gonorrhea, so they can be treated. So you see, last time also there was one drug where we treated gonorrhea and this chlamydia. Who remembers? Anybody remembers gonorrhea and chlamydia? So that day the hint is, I was telling you that many people say that for this we have to use exclusively some drug, but that is not true. Do you remember?
স্যার একবার বললে ভালো হয়।
Cephalosporin.
ও হ্যাঁ হ্যাঁ সেই হুম
So you see, once again we can treat the same with tetracycline as well.
হুম মানে এগুলোর কোনো মানে অ্যাকচুয়ালি কোনো ইয়ে নেই
হ্যাঁ। Okay.
মানে হ্যাঁ
All right. Now other diseases that can be treated, that is acne vulgaris. Acne vulgaris is basically the full name of simply acne. So so technically, even the in dermatology also you can use this kind of drugs. So normally, if there are any sort of comedones, do you know what are comedones? Do you know what are blackheads and whiteheads? Any idea?
স্যার ব্ল্যাক হেডস তো স্কিনে হয় যখন খুব ডার্টি স্কিন হয় তখন ব্ল্যাক হেডস টাইপ অফ ইয়ে করে
Actually, what happens is, suppose you have got a skin, so in the like on the surface of the skin there is present like some pores. Now if you go to that pores, inside the pores you will be landing up to this what do you say, you will be landing up inside the sebaceous gland, okay, the sebum. So when you will see the sebaceous gland, so that sebum normally leaks out, makes your skin oily, prevents it from dehydration and all those things. Now there is a trouble. The trouble is that sometimes you develop something like hyperkeratinization. You develop excess keratin. So if you develop excess keratin, then you will see that it is going to block that opening, the pore gets blocked. Now if the pore gets blocked, then can those sebum, can they come out easily?
না স্যার
Nah. So if the sebum does not or cannot come out easily, so that sebum gets stuck up over there, and you get to see it more of a like blackish in color, and that is what you call it as the blackhead. Then if you don't do anything about it, say it remains like that for a few more days, it remains like that. So what happens, it gets oxidized because it is coming in contact with the air. Now if it gets oxidized, then you will see that that turns white, the black color turns white, and if the black color turns white, we can call it as the whitehead. So this is how blackheads, whiteheads, then gradually over there is a organism, that acne vulgaris organism can set in, and it will make it red, and there will be redness, pain, all those things will happen, and bus we will say that okay, congratulations, you are suffering from acne. Understood?
হ্যাঁ স্যার বুঝেছি
Okay.
So that is basically blackheads, whiteheads, like pimple, acne, that is comedone. So even there will be papules, pustules. Do you know what are papules and pustules?
স্যার প্যাপিউলস মানে ওই মানে প্রজেকশনস আর কি কিছু
Acha, you don't know projection. Acha, and pustules?
জানি পোস্টিউলসটা জানি না প্যাপিউলটা মোটামুটি ওটাই আর কি মানে একটা জেনারেল আইডিয়া আছে
Look, these are all dermatological terms. Okay. Many a times you will see papule is also occurring, pustules are also occurring. How will you understand which one is what?
হ্যাঁ স্যার আগে বলবেন একটু কেটে গেছে
Sometimes you will see papules are also occurring, pustules are also occurring. So how will you understand which one is what? These are all dermatology concept. So do you have an idea about this? Like, do you know the definition?
না স্যার সেভাবে তো জানি না
Acha, so there is a definition. Like there are, you have to know. So I think somewhere, in short, you can write it down, because it is not included in the slide. It is off the track discussion. So you can write down. Papule is a circumscribed, elevated, solid lesion with depth up to 2 centimeter. Oh, I'm so sorry. Just a sec. Not 2 centimeter. It is usually 1 centimeter. So it's a elevated solid lesion, not depth. Sorry. Why will you write depth? You write a solid lesion up to 1 centimeter in size. Written up to
হ্যাঁ স্যার
1 centimeter. 1 centimeter in size, and you can write down full stop. Elevation may be accentuated with oblique lighting. Just this is like complete definition. You will read maybe elaborately in general medicine next year. So if I teach you next year medicine, then I'll teach you in detail. For the time being, what is your concern is that it should be elevated, it should be solid, it should be 1 centimeter in size. Okay.
স্যার ওই কি বলবো দানা দানা কিছু একটা বেরোয় যখন স্কিনে ওরকম
হ্যাঁ, ঘামাচি.
হ্যাঁ ঘামাচি টাইপ
Then you can write pustule. Write it down.
হ্যাঁ স্যার
That it is a circumscribed, elevated lesion. Filled with purulent fluid.
Sir.
Huh?
Purulent.
Purulent. Purulent fluid less than 1 centimeter in size.
হ্যাঁ স্যার
Okay.
হ্যাঁ স্যার
Okay.
All right. So this is one thing. This is about acne. Okay. Then there is something called as rosacea. What is rosacea? Rosacea is a condition of skin. Again, these are all different types of skin diseases. Like here, what happens is there is redness, there is flushing. Flushing is once again the redness. Then there will be appearance of small bumps on the face which are filled with pus. Okay, that is called as rosacea. Have you seen? Well, I don't think so. You have seen. Have you seen any case of rosacea?
না স্যার
Sir.
Acha. Right now, no need to worry. Next year, if possible, I'll show you. Nowadays, like if I have to tell you some related things, nowadays you will see, I have seen in Facebook or in YouTube, some cosmetologist, what do is they come up and they take a needle and they will prick one, some bumpy things on the face, they will squeeze and they will, take out some of those.
হ্যাঁ স্যার দেখেছি, হ্যাঁ স্যার দেখেছি,
Seen that?
স্যাটিসফাইং লাগে ভিউ।
That is rosacea.
ও আচ্ছা স্যার, ওটা পেন্সিল টাইপেরই তো, ফোড়া বলে না? ফোড়া
That is not foda, that is not pimple also, that is somewhere middle. That is rosacea.
ওকে স্যার।
That is, they just prick it, they pull out the pus from there.
হ্যাঁ স্যার দেখেছি।
So that is called as rosacea. So you see, if you do, like when there is rosacea, so actually rosacea, so you have to clean it properly in a different way. But ideally, if there is rosacea, there is redness in those areas. So if you are thinking that how to prevent it, so how to stop that redness or inflammation, then you can give tetracycline. So tetracycline is good for treatment of rosacea also. Okay. Chalo, at least now you know what is rosacea. All right. So, and what about Lyme disease? Lyme disease is basically something which occurs due to ticks. So here it is written like Spirochete bacterium, Borrelia, Burgdorferi. But in general, do you know what is the problem with Lyme disease? Do you know what is Lyme disease in general?
না স্যার।
Lyme
Yeah,
disease.
sir.
Lyme disease is a neurological disease. Okay, it's a neurological disease when this organism, this Borrelia burgdorferi, this organism, it can it can affect the cranial nerves also. It can affect the peripheral nerves also. Even it can affect central nervous system also. Okay, so normally you will see there are a lot of, like, you have studied facial palsy in your anatomical classes.
হ্যাঁ স্যার, বেলস পলসি।
So here also there can be palsy occurring. So it's a neurological disorder. So if you are in a early stage of Lyme disease, so in simple language it is caused by ticks. We call them tick. Tick though you have heard, maybe Borrelia burgdorferi you haven't heard, but tick though you have heard. So tick biting causes this thing. They are called as tick in general language. So it's a spirochete basically. So initial time tetracycline is very very effective, and that drug doxycycline, which is a type of tetracycline, we give doxycycline sometimes, but many times doxycycline doesn't work actually. Okay.
হ্যাঁ স্যার।
All right. Then comes up malaria prophylaxis. What is the prime drug for malaria?
স্যার ম্যালেরিয়ার জন্য তো ওই কুইনিন ছিল।
কি ছিল?
কুইনিন।
Quinine, yes. So remember, that is for treatment of malaria. But what about prophylaxis against malaria? So once again, tetracycline is used as a prophylactic agent against malaria. Primarily, if there is Plasmodium falciparum, primarily if those mosquitoes or those malaria has developed resistant strains, okay, against the general anti-malarial drug like quinine, chloroquine, okay. So against these, if there is any sort of resistance developed, once again tetracycline can be helpful. But once again, tetracycline is not a good drug for malaria, but like you can use it. So if it doesn't work, then you can have to use some other, and there are a lot of anti-malarial drugs present. So you have to use those other anti-malarial drugs which are of modern days. But tetracycline can also be another drug. Now finally comes up the dental uses. So as far as the dental application is concerned, tetracycline is used in cases of periodontal disease. So basically, when you will be posted in perio, this is the antibiotic which is like one among the best antibiotics given. Now you cannot use it in every case. You cannot, like, suppose there is a mosquito and you are firing from cannon, you are making atomic explosion just to kill a mosquito. So you cannot do that. But if there is any such disease which is not getting cured by our regular drugs that we provide, other antibiotics that we provide, if it is not getting treated by that, then definitely tetracycline is your choice. Okay, so that is when we prescribe doxycycline drug. This is what I was telling. There is a patient who come with periodontitis. The general drug that we give, that is metronidazole. So why we give that, we'll discuss separately someday. So actually metronidazole, in short, if I have to tell you, then it works against the anaerobes, and mainly your gum infection is occurring because of the anaerobic bacteria. Now if metronidazole is not causing relief to the patient, then definitely the person must be taking this tetracycline. So tetracycline works like magic in these cases. If metronidazole fails, tetracycline works like anything. Clear? So in like we use it quite often in perio cases. Okay.
Okay.
Alright. So moving on to the adverse effects. So as far as adverse effects are concerned, what are we getting? First of all, GI disturbance. So as far as GI disturbance is concerned, so there will be definitely nausea, vomiting will be there. It's common for every medication. So if a patient says that I am having such kind of symptoms, so what to do? So now you ask the patient that okay, fine, you take the medication with food or milk. So ideally, is it good to take the medication with food or milk? Is it good to take tetracycline with food or milk?
Not so.
No, because it will slow down absorption. But if the person is showing nausea and vomiting, that means the person's mucosa, the person's gut, is not capable of tolerating that tetracycline. So if they are having trouble in tolerating tetracycline, then you can give those milk, food and all those things along with that. So not the entire amount will absorb, little less will be absorbed, but slowly work will be done and patient will also be okay. Okay, so nausea and vomiting, and then comes up diarrhea. So actually taking tetracycline will lead to diarrhea. So there is this organism that is called as pseudomembranous colitis. So in your body, if there is Clostridium difficile, that means this is another Clostridium species. So over there, pseudomembranous colitis may take place. So you are taking the drug to kill Clostridium difficile, and maybe Clostridium species will die because it was in the spectrum. So though Clostridium species will die, but still you will develop pseudomembranous colitis. And if you develop pseudomembranous colitis, then there will be definitely diarrhea. Okay?
Awesome.
So moving on to photosensitivity. Now this is a very very weird kind of a side effect. Photosensitivity, sensitivity towards photons. The person becomes sensitive to sunlight, cannot look at the sunlight. If looks at the sunlight, then turns red and everything. Okay, not only sunlight, even UV rays. Okay, so there can be skin rash and all these severe things can happen. Even the
Sir, vampire major.
vampire has sort of, yes. So if any person is taking tetracycline, then along with tetracycline you should advise the person to use a sunscreen, okay, or unnecessary, the person should not go out into the sun. So if you are a good doctor, then you can simply just prescribe doxycycline, doxTSL. But if you really want to become some helpful doctor, really helpful doctor, then after you prescribe tetracycline, you should also ask the patient all these things. That if there is photosensitivity chances, patient should use like sunscreen and all. So these are all some good advices that you can give. Now, what did we discuss? We discussed that tetracycline comes out through the breast milk. Remember, in absorption.
Yes, sir.
So tetracycline comes out through breast milk. Naturally, the child will be getting it, even the child if uterine, then also the child gets it, because tetracycline can cross placenta also. That also we have studied. So tetracycline can cause placenta, tetracycline can cause cross breast milk, or it can pass through the breast milk. So tetracycline, if the mother is taking tetracycline, then definitely the baby will get tetracycline. Yes or no?
Yes, sir.
Yes. So if tetracycline is definitely entering the body of the baby, then it affects bone and tooth development. So what happens is, you should not give tetracycline to children. In children, tetracycline is contraindicated. Now children means how small or how big? So less than 8 years old should not give. Pregnant ladies should not give. Okay, in first trimester you can give, but definitely not the second and the third trimester, when the teeth will have a tendency to develop. So you cannot give it during the pregnancy. Okay, so pregnancy and less than 8-year-old kids, you should not give them. Otherwise, what will happen? Bones and teeth both will be discolored. Next comes up.
স্যার
হ্যাঁ,
স্যার তাহলে যে মারা ব্রেস্ট ফিডিং করে তাদেরকেও তাহলে দেওয়া যাবে না?
না যাবে না তো, ডেফিনেটলি না। বাট মোর ইম্পর্টেন্ট হচ্ছে প্রেগনেন্সি, বিকজ teeth, see, it doesn't get absorbed in the mouth, but during its development, when it was creating the bone, when it was creating the teeth, since that time, if tetracycline is there, then tetracycline forms bond, like chelating bond with the hydroxyapatite and all those things, and that changes the color. Understood? So the breastfeeding is okay, but breastfeeding is not a big concern. Big concern is pregnancy, when tooth was developing. Yes. Now the thing is this, that see, this is such a dangerous antibiotic that it doesn't know whom to kill, whom not to. So it will kill whatever it gets in front. And if it kills whatever it gets in front, do you realize that the fight between that good bacteria and the bad bacteria, the good bacteria will lose that fight, because bad bacteria will take its place, ain't it?
Yes, sir.
And if your resistant bacteria goes off, if the symbiotic bacteria goes off, there will be chances of supra-infection. Most supra-infections are either bacterial or yeast based. Like here I have written one thing, that is, there is a condition called as candidiasis. Do you know? It's a fungal disease caused by Candida albicans. It can occur in the mouth also, it can occur in the vagina also. So there can be oral candidiasis as well as there can be vaginal candidiasis. So if you are actually destroying the resistant bacteria, then don't you think that even these diseases can happen? They can occur? Yes. And now comes up then, like you were asking, for every case can we use tetracycline? No. Where is the problem? Problem is the liver. Do you understand? Liver, big problem. Liver, you have to take care of the liver. Most important thing. So it is associated with like all the liver dysfunction. So if you are prescribing somebody tetracycline, so you see what all things you have to keep it in mind. You have to ask the person to get LFT done. LFT, you know? Liver function test. You have to check for jaundice.
Yes.
What is jaundice? What is the definition of jaundice?
স্যার যখন বাইল সিক্রেশন বেশি হয় বা মানে কি বলবো বাইল সলস বিলিরুবিনের বেশি হতে।
Jaundice is a symptom. Jaundice is not a disease. Jaundice is a condition. Jaundice is yellowish discoloration of skin, oral mucosa, palm of the hand, sole of the feet, due to increased bilirubin level that you can say in the blood, that is called as jaundice. Okay?
Yes, sir.
All right. So you see, if you are giving any patient tetracycline, make sure you give the instructions whether to take it with food, without food, before food, after food, whether you should check for the liver profile, whether we should give it to pregnants, whether we should give it to children below 8 years of age. Okay, you have to keep so many things in mind. Okay, only then you can prescribe tetracycline.
স্যার
হ্যাঁ
বলছি যে বিফোর ফুড আর আফটার ফুড এটা তো খুব একটা ভ্যারি কিছু করবে না।
না ওই যে if you want maximum action you have to take it empty stomach. So after 2 hour after food mostly gastric emptying has started, so stomach has become little empty at least, so then absorption can be a little bit faster. Before 1 to 2 hour. হ্যাঁ বল।
বিফোর হচ্ছে তার মানে আফটার ফুড দেওয়া, মানে খাওয়ার পর।
No, even 1 to 2 hour before food also you can give, then also the stomach is empty.
হ্যাঁ, ওকে।
But once again, if the stomach is empty and the person develops irritation, like the body irritation, stomach irritation or something, then you should ask the person to take it with milk. You should ask the person to take it with anything that is chelating agent like milk, okay, and regular food with all those things. Then absorption will be slower, and maybe the person was not capable of taking up such fast absorption. So if you slow down the absorption by adding food, then maybe the patient will be a little bit relieved.
আচ্ছা, তার মানে স্যার সেক্ষেত্রে তো ওই 1 to 2 আওয়ার্স এর গ্যাপটা থাকবে না, তার মানে খাবার পরই খেয়ে নেবে মেডিসিনটা।
হ্যাঁ ডেফিনেটলি খাবার পরেই খেয়ে নেবে। Okay. Then finally comes up another set of disease, that is the renal diseases, because tetracycline is nephrotoxic. So you see it is hepatotoxic as well as nephrotoxic, damaging to liver, damaging to kidneys, so damaging to everybody. All like two vital organs, liver and kidney, both are under threat if you are taking tetracycline. Keep it in mind. So if a patient is having any sort of pre-existing kidney condition, so you should not give these drugs. Or if you see that the patient is already taking some other drugs which are nephrotoxic in nature, then you should titrate the dose. You should check like whether this drug can be given or not. Okay, you have to find it out, those things. What are other nephrotoxic drugs?
স্যার জেন্টামাইসিন আর প্রোগ্রামাইসিন।
Very good. Mane aminoglycoside, isn't it? Not only that, even fluoroquinolones. Okay, ciprofloxacin. Okay, not only that,
Okay.
even those what do you say, cephalosporins, beta-lactam antibiotics. So so basically everybody almost beta-lactams will include both penicillin and cephalosporin, then aminoglycosides. Okay, and we can ignore those what do you say, macrolides and all. So main is aminoglycoside, and yes, aminoglycoside 2. Even your like I said, fluoroquinolone, and today we are discussing these tetracycline. Okay, all of them, they can cause renal failure. Okay, later on we will learn that rifampicin, okay, rifampin actually, and even vancomycin, they all are nephrotoxic antibiotics. Okay, later on we will learn antifungal. Whenever we give antifungal drugs, we mainly give it topical, ointments and all. We don't give tablets, though tablets are available, but we usually do not give it. We give it when it is necessary, but usually we do not give it, the antifungals, because even antifungals are nephrotoxic, so they damage the kidney. Next comes up allergic reaction. The allergic reaction though can take place to anybody, so I am not discussing about that. Next comes up the vestibular effects. Now vestibular effects includes vertigo and dizziness. Okay, so you have to just make the patient understand that it is normal and normal to experience this stuff, and if the person can take rest, then the person might feel all right. So there can be some dizziness, there can be some vertigo, can be, all of these are can be, it's not like will be. Okay, so they will be having this balance and coordination wala issue. Then a rarest form is the blood disorder. So there are a lot of hemolytic anemia, okay, thrombocytopenia. With all these things, there is some connection with tetracycline. The tetracycline can cause these kinds of trouble. Okay. Then moving on to drug interaction. So, first of all, already what we have discussed, that is calcium, magnesium, aluminum, chelation. So I don't think I need to explain again. Same goes with antacids. Correct, na?
Yes, sir.
Yes, sir.
Alright, so you see, if a patient needs to take antacids, what will you do? So it should be taken 2 to 3 hours before or after tetracycline. So either you are supposed to have food at say 10 o'clock, so 7 o'clock you take antacid, then 8 o'clock you can take tetracycline, or no, I should say, like 7 o'clock you take this antacid, then direct 10 o'clock you take tetracycline. So you are taking tetracycline with food, but that 7 o'clock if you are taking antacid, then antacid will not interfere with tetracycline. So you have to tell it to the patient also. Like you cannot everywhere just like whenever you feel like you can take antacid. If you are taking tetracycline, you have to remember about that as well. So understood?
Yes, sir.
Okay, next comes up oral contraceptives. So efficacy gets reduced. So if a person is on tetracycline therapy, then suppose the person is taking pill, no issue, still the person can use condom. So oral contraceptive, you have to take double protection. You cannot base yourself on single protection. Then there is warfarin. What is warfarin? Warfarin is an anticoagulant. So it prevents clotting. So tetracycline actually potentiates warfarin. If tetracycline comes up, then there can be a chance of bleeding because it is potentiating the anticoagulant effect. Okay. So you have to go for a prothrombin time, PT. Basically we go for INR. And okay, then comes up isotretinoin. So tetracycline and isotretinoin together causes intracranial hypertension, which can lead to stroke also. Plus, you should not prescribe tetracycline with penicillin because they antagonize each other's effects. So don't think ki acha chalo sir said tetracycline is such a good drug, it will take care of the gum, and patient has come up, I am not understanding even what is the case. So if there is any dental aerobic infection, amoxicillin can take care. If there is any other infection, tetracycline will take care. Let me write both amoxicillin and doxycycline. Useless. Okay? It won't work. Understood?
Yes, sir.
Yes, sir.
Then comes up methoxyfluorine. What is methoxyfluorine? Methoxyfluorine is a inhalation anesthetic. Now, if methoxyfluorine you are using on somebody and you are still using this tetracycline, then once again it will be nephrotoxic. So this combination can lead to nephrotoxicity. So should be avoided. Do you know what is the role of lithium in our body? Lithium ion is a mood stabilizer. So lot of lithium based drugs are there which are used for those people who develop too much mood swings and all. Okay, so lithium based drugs are given to them. So if a person is taking those lithium drugs, even tetracycline increases the lithium level in the blood, and that leads to lithium toxicity. Okay, so if a person is taking tetracycline, then the person must be under monitor for what is going on with the lithium level in the body. Okay.
Okay, sir.
Then there comes a methotrexate. What is methotrexate? Do you know what is methotrexate? Have you heard of this word methotrexate? I think you have heard this word. Like I only have, I think so. only have discussed it.
হ্যাঁ স্যার শুনেছি এটা
শুনেছিস?
মনে পড়ছে।
আচ্ছা, তো should I tell?
হ্যাঁ
একবার
স্যার
বলে দিই।
Methotrexate is used to treat arthritis, psoriasis, all these diseases.
ও আচ্ছা।
So if you are using tetracycline, then again methotrexate level in the blood increases. Like it can rise up to toxic level also. Then comes up retinoids. Retinoids are available as tretinoin or isotretinoin. Mainly they are available as ointments. But whatever it is, still you should not use tetracycline and this isotretinoin or tretinoin. So if you do that, they will be causing again intracranial hypertension. We just discussed a moment back. And of course, alcohol drinking is bad, but tetracycline and alcohol, if a person is taking, then alcohol can exacerbate the side effects of tetracycline. Okay, the direct effect is not there. There are some indirect ways by which it can cause the stomach upset. It can also cause dizziness. Okay, these things can take place. So this is like a falcon, but definitely should not be used with alcohol. Then finally comes a contraindication. So first of all, hypersensitivity. If you think you have it, then don't take it. Then pregnancy, that is after 4th month, that is around the 3rd trimester. So should not give tetracycline at all, because tetracycline will get deposited in the bones and teeth. You remember we have discussed this a few times. Yes. Then you cannot give it to the breastfeeding mothers. Now you know the reason why. Then children below 8 years of age, you know the reason why. Hepatic impairment, again you know why. Renal impairment, again you know why. See, we have discussed all these things. Now, understood till this much?
হ্যাঁ স্যার।
Correct. Next comes up a thing called as porphyria. Anybody knows what is porphyria?
না স্যার
Acha. Porphyria.
হ্যাঁ স্যার,
Huh?
জানি না।
Acha, porphyria is basically the hemoglobin contains a part that is hem and globin. Do you know this?
হ্যাঁ স্যার জানি
হ্যাঁ।
porphyrin হ্যাঁ porphyrin
Porphyrin, yes. So that porphyrin is required to create heme. So if there is excess amount of porphyrin in the body, then that condition is called as porphyria. So it's a rare genetic disorder. So it is of course a genetic disorder. So if a person is having porphyria, then tetracycline should not be given. Remember. And all those drugs and all, so you did it well. So whatever you learnt over there, those we discussed those drugs, which are like isotretinoin, tretinoin, and all those drugs, antacids and all. So that will also be a contraindication. You cannot use it along with them. Okay, so that's it. Understood?
ওকে।
হ্যাঁ স্যার
All right.
হ্যাঁ স্যার।
There is another category of drug which usually is taught along with. So that drug is called as chloramphenicol. So chloramphenicol also inhibits the protein synthesis. Alright, so chloramphenicol is very similar. So I'm not like chloramphenicol, from there questions won't come up normally. Now chloramphenicol is also inhibiting protein synthesis. Then what is the difference between this tetracycline and chloramphenicol? Actually chloramphenicol binds to 50S. Who else was binding to 50S?
macrolide
Correct. This time chloramphenicol is also binding to 50S. Okay, and chloramphenicol similar, both gram positive, gram negative, similar, same typhoid it can work it, but chloramphenicol, one thing is there, it can work against the anaerobic bacteria. Okay, like normally what have we learned? Tetracycline work against the aerobic bacteria. Chloramphenicol can work against the anaerobic bacteria as well. Uh, Now here, one thing is there. We have learned that there is discoloration of teeth and bone in case of tetracycline. One similar point you should remember, that is called as the gray syndrome. Do you have any clear idea about what is gray syndrome? Does the body color turns gray?
Blindness with gray syndrome.
So actually yes, body ka color becomes gray. Gray syndrome, it is also called as gray baby syndrome. So it occurs as a adverse effect of chloramphenicol. What happens here? Here there is, the skin becomes gray colored. There can be hemodynamic collapse. There will be abdominal distension. Okay, so you see, there can be, this is a very very important thing in the babies, in the newborn. So gray syndrome. Plus another bad thing that can happen, that is bone marrow suppression can take place. And aplastic anemia, though, is a chronic condition. It won't happen acutely, but that can also happen. Okay, so these are certain things that you have to keep in mind in chloramphenicol. So you see, chloramphenicol doesn't have any further good point. So understood this part, like tetracycline and chloramphenicol. So chloramphenicol is like in dentistry we don't use much, but okay, at least you should know that there is another antibiotic which binds at 50S. So clear for today?
Yes, sir.
We have finished this tetracycline and chloramphenicol. Okay, there is nothing more to discuss here.
Yeah.
Okay, chalo फिर, see you next class. Do those homework
Yes.
also, that questions I have given you, even solve that.
হ্যাঁ স্যার হাফ হয়ে গেছে অলরেডি
হয়ে গেছে? Okay, great. So I'll give you more questions then. All right.
স্যার এই উইকে আর কোশ্চেন না দিলেই ভালো হয়, কারণ মানে শুক্রবার দিন প্র্যাকটিক্যাল লিখে সব সাবমিট করতে বলে সব।
Oh, acha, acha. Okay, ठीक है. So I'll give now during my time, and whenever your time comes up, then you can simply, like you can do it at that moment.
ওকে স্যার।
Okay. So fine then. Let us stop over here today, and see you in the next class.
হ্যাঁ স্যার, গুড নাইট স্যার।
Yep. Good night.
বাই।
Good night, bye.
Bye bye. হ্যালো, হ্যাঁ, গুড ইভিনিং। আপনি ফোন করেছিলেন? হ্যাঁ হ্যাঁ, বলুন বলুন। আচ্ছা, হুম হুম, ওকে। আপনি কি সকালবেলা কালকে আসতে পারবেন? আমি সকালবেলা অ্যাভেলেবেল আছি অ্যারাউন্ড 11টা নাগাদ। আচ্ছা, তাহলে আপনি শনিবার দিন সন্ধ্যাবেলা একটু চলে আসবেন, আমাকে একটু শুক্রবার দিন একটু কল করে নেবেন এরকম, আমি আপনার নামটা লিখে নেবো, অ্যাপয়েন্টমেন্টটা সেট করে দেবো তাহলে। দেখুন এমনিতে তো স্যারের ভিজিট হচ্ছে 200 টাকা। এবার আপনি এলে উনি আপনাকে বলে দেবেন যে আপনার মানে কটা অ্যাপয়েন্টমেন্ট লাগবে বা কী ট্রিটমেন্ট হবে, কিভাবে ওটাকে সাদা করা যায়, সেটা তো মানে কত কি কালো বা কি স্পট রয়েছে ওটা না দেখে তো বলতে পারবেন না উনি। তো আপনি একবার চলে আসবেন, উনি দেখে সব আপনাকে গাইড করে দেবেন কী করতে হবে না করতে হবে, ইমিডিয়েটলি করা যাবে কি না, বা আপনাকে নেক্সট অ্যাপয়েন্টমেন্ট নিতে হবে কি না সেটা সবই বলে দেবেন উনি। আপনার সাথে ডিসকাস করেই করা হবে। আচ্ছা, আপনি সুভাষগ্রাম হসপিটালটা চেনেন কি? আপনি হসপিটালের যে মেন গেটটা রয়েছে ওই অবধি আপনাকে আসতে হবে, ওই মেন গেটের উল্টো দিকে একটা ওষুধের দোকান আছে দেখবেন, ওখানে জিজ্ঞেস করলেই ওরা দেখিয়ে দেবে আপনাকে। ঠিক আছে, আর নইলে আপনি আমাকে এই নম্বরে আপনি একটা আপনার নামটা লিখে পাঠিয়ে দিন, আমি আপনাকে মানে লোকেশন শেয়ার করে দেবো। ঠিক আছে, ওকে ওকে ওকে, ঠিক আছে, হ্যাঁ, থ্যাংক ইউ। হ্যালো। হ্যাঁ, আমি ডেন্টাল ক্লিনিক থেকে বলছি, আপনি কি ফোন করেছিলেন? আচ্ছা। হ্যালো, আমি ডেন্টাল ক্লিনিক থেকে বলছিলাম, ফোন করেছিলেন? হ্যাঁ হ্যাঁ হ্যাঁ। বেশ ভালো। হুম। আচ্ছা আচ্ছা। না না, ভয়ের কিছু নেই, আপনার কদিন হলো দাঁতটা তোলার পর? কালকে 8 দিন হবে, আপনি কালকে কি সকালে ওই 11টা 12টা নাগাদ আসতে পারবেন? 5 মিনিটের কাজ, একটু চলে আসুন, আমি বাকিটা খুলে দেবো তাহলে, অসুবিধা নেই। ঠিক আছে, ওকে ওকে, হ্যাঁ, রাখছি।